Back to one of our top stories, President Jimmy Carter revealing that doctors have found cancer spots on his brain. Carter says he had a small mass removed from his liver earlier this month, and the way he's fighting the disease is truly inspirational. I'm joined now by Dr. Andy Salner, from the medical director of the Hartford Healthcare Cancer Institute at Hartford Hospital. Thanks for being with us today. The former president's setting a really positive example for anyone facing cancer, don't you think?
I totally agree, Brent. I think to share, in his position, to share with the public what's going on is really important, particularly since there's some hope in terms of the treatment, even though the disease is advanced.
We were talking about this earlier, and he is taking a very positive approach, but like you said, it's as much about the transparency.
Absolutely. I think people would be so anxious to know what's going on if the president were ill, and the fact that he's sharing it, recognizing that there's some hope that his treatment will be successful.
And let's talk about that. You and I were just talking in the break. He is getting a new cancer drug that gives hope for melanoma specifically. Tell us about it.
That's correct. Melanoma responds to immunologic modulators. We've known that for many years, but just in the last 2 years we have 2 new sets of drugs which can attack melanoma cells in unique ways. And for the first time we're seeing large numbers of responders in people who have advanced melanoma.
So it'll be interesting but informative to see how he goes through this and how this drug works for him. 90 years old, but in good health, a very active fellow. And as we said, you know, at his age, as positive as he wants to be going in, this is no picnic. He's in for the radiation and chemotherapy. What can he look forward to?
Right. Well, the radiation is likely to be targeted treatment to the 4 spots. That's something we call stereotactic radiation. It's highly focused. Doesn't treat the whole brain, just treats those 4 spots focally with high doses that actually enable the radiation to ablate the cancer cells in those spots. The drugs that he'll get don't go into the brain, so that's why we need the combination of radiation and chemotherapy. The treatment will cause some fatigue as the main side effect, and some other general side effects, but hopefully not severe.
Okay, hopefully so. Now, a high-profile case like Jimmy Carter's, this can often help with awareness for what the medical community is up against. How might President Jimmy Carter's case benefit cancer centers and ultimately other cancer patients?
Well, certainly melanoma is a disease that's increasing primarily due to sun exposure, so we're trying to tell everybody to please be careful about sun exposure and avoid tanning booths. That's a risk for melanoma. But also, it's hope for people who have advanced cancer or any kind of cancer, that there are new therapies that do offer hope for response. Jimmy Carter's cancer won't be cured, but hopefully it can be controlled and made chronic for a long period of time. So that really offers hope to a lot of people. 43% of us will be diagnosed with cancer in our lifetime. And for the 65% who survive 5 years without recurrence, that's great. But for everyone to know that we've got these new therapies that offer hope for survival.
Okay. All right. Dr. Andy Salner, thanks for joining us today.
My pleasure.
All right. Katie?